So hi, welcome and thank you for joining us for this session today. My name is Rachel Thompson. I'm the consultant Admiral Nurse for Lewy Body Dementia, and I'd like to introduce Chris.
Hi everybody, I'm Chris and I'm living with Lewy Body Dementia.
Thank you. So today we're going to tell you a little bit about how we've been developing a new service to support families affected by Lewy Body Dementia. So I'll just share my screen. So really this is just giving you a bit of a background. This was a service that was set up the end of last year, and I'm going to tell you a little bit about how we started the service. But firstly, I just wanted to talk a little bit about Lewy Body Dementia. Lewy Body Dementia, we talk about it as being the most common disease that you've never heard of. And the reason for that is actually it still remains quite unknown, despite the fact that it's the second most common cause of neurodegenerative dementias, with approximately 10 to 15% of people with a dementia having this type of dementia, and that accounts for about 100,000 people across the UK. It's probably helpful also to highlight that Lewy body dementia is an umbrella term, and it includes both dementia with Lewy bodies, which is a condition when the cognitive symptoms and the dementia occur before the onset of Parkinsonism. This is really important because there is a strong link between this type of dementia and Parkinson's disease, because they're both caused by Lewy bodies. The other type is Parkinson's disease dementia, and this is where the Parkinson's symptoms occur first. So, why are we setting up a service specific for Lewy body dementia, and why is it important? Well, there's a lot of literature and research that's starting really to highlight that actually there's still poor understanding and recognition of this condition by professionals. As a result, sadly, people are still having a lot of problems with getting a diagnosis, often because their symptoms may be slightly different, and we'll talk about that in a minute. But also, these symptoms are often quite numerous and complex, and as I mentioned before, have a strong link with Parkinson's, so may not be picked up. People also sometimes have a poorer quality of life and well-being because of the combination, the complexity of the symptoms. But in addition, sadly, that people often are not getting enough specific information about the condition, how to manage, what to expect, lack of post-diagnostic support. And also, families often talk about falling between gaps between services. So people may be supported either by Parkinson's services or neurological services or dementia services, and sometimes those services are not coordinating or connecting with each other. So I started in post in December 2019, having worked as an Admiral Nurse for a number of years, and I was lucky enough to be appointed into this role, which has been funded by the Lewy Body Society, who are a charity who have historically funded research, but we're really keen to try and offer something more to help raise awareness of Lewy body dementia, but also offer some clinical advice. They already had a relationship with the Admiral Nurse Dementia Helpline, but wanted to be able to offer a little bit more. So I applied for the post and I started in December 2019. And so when I set up the service, I started really by having an opportunity to think, well, what's most important? And my first step really was to ask the experts. So I connected with a number of people, both professionals and family carers, and firstly asked their view about what they felt was most important. So that was 9 families affected by Lewy body dementia, which was 7 carers and 2 people living with Lewy body dementia, and a number of professionals who were kind of leading specialists in the field, which included old age psychiatrists, neurologists, Parkinson's specialists, and also some researchers. I looked at their feedback and I themed it, and then I used that to inform a survey which I sent out to the Admiral nurses just to kind of get their views as well. And I asked them a number of things really. So what are the main challenges? What did people think were the most difficult symptoms or changes that people were having to cope with or manage? Also, what support families would most benefit from? Where were the gaps? But also importantly, what do people think the consultant Admiral nurse post, and how could it have the most impact really? So I was lucky enough to meet Chris Maddocks, who was one of the people who kindly shared her experience. So I'm going to hand over to Chris, who's going to tell us a little bit about her experience. So over to you, Chris. I think you're on mute, Chris.
Sorry, not a good start. Hi, everybody. I just want to say that I am reading from notes, so I apologise for looking down, but you wouldn't get probably it all making sense to you if I wasn't doing this. I was diagnosed with vascular dementia in July 2016 when I was 60 years old. This was following 3 minor strokes. In 2018, I was diagnosed with Parkinson's disease, and in January 2020, diagnosed with Lewy Body Dementia. Following the strokes, I had cognitive problems and extreme fatigue. Before my first diagnosis, I was forgetting things, like taking my medication. I had no clear train of thought. I had difficulties with decision-making and concentration. One morning, when I got up, I couldn't remember how to get dressed. I didn't feel I could multitask anymore. I used to say, there's something not right in my head. I went to the GP with my concerns, and she said, I'm here for your physical health, not your mental health. If I thought you had a problem with your memory, I'd refer you to the memory team, but you don't. I left the GP surgery in tears. I was sent to the Elderly Care Assessment Service in May 2016, and then given a diagnosis of vascular dementia, which I wasn't expecting. I remember hearing the words dementia, and I didn't hear or take in anything else the consultant said to me. I cried for 3 months. I couldn't speak to people without bursting into tears. It felt like I'd been given a death sentence. I didn't really know what was going on. I really thought I was going mad. I didn't have anyone to talk to apart from my partner. I left the consultant's office with no information, no referral to support services. I needed information to better understand my diagnosis, how I could still live my life, how everything would fit into place. How long did I have left to live? I lost my job 3 months after my dementia diagnosis. I plucked up the courage to ring Alzheimer's Society. Their staff came to my house to see me, and I attended a Living Well with Dementia course. I had so many questions. After my diagnosis, I was feeling scared, lonely, isolated, frightened, emotional, frustrated, useless, lost. I became depressed. It was difficult to explain to people what was going on when I didn't know myself. I didn't want to socialize and became a prisoner in my own home. I had a diagnosis of Parkinson's disease in 2018. I had a tremor in my hand and arm and was always feeling tired with no energy. I had fantastic support from my Parkinson's nurse specialist. I started Parkinson's medications, attended weekly hypnotherapy groups, exercise groups, and joined a Parkinson's singing group. Things to look forward to and I enjoyed, all helping control my Parkinson's disease and symptoms. However, in January 2020, I went to see a neurological consultant following brain scans and symptoms of loss of taste and smell, lacking spatial awareness, and was always covered in bruises, restless and painful legs, difficulty in getting to sleep at night and staying asleep, lack of energy, anxiety and low mood, balance issues, changes cognitively and more forgetfulness, swallowing difficulties, forgetting to do things, little interest in doing things, difficulty concentrating and staying focused. The consultant told me that the likelihood was that I had Lewy body dementia, but it could only be confirmed on autopsy. I remember thinking, well, I'm not ready for that yet. I was expecting to be told about changes from the most recent scan. I was not prepared for a further dementia diagnosis. Once again, I left the hospital with no information or follow-up appointments. I was just sent home. I remember the dreadful feelings coming back. It's the same as when I had my first dementia diagnosis. That is, I'd been given a death sentence. How is Lewy body dementia going to affect me? How long do I have to live? So many unanswered questions. Who do I turn to? I found out about Lewy Body Society and telephoned them. A lot of my questions were answered. And to my surprise, they also had a consultant Admiral Nurse, Rachel, attached to their society, to whom I was referred. I received tremendous help and information. They threw me a lifeline. My consultant Admiral Nurse Rachel, whom I'm with here today, was and is brilliant. The support was for me, but also for my whole family, by finding out what my difficulties were and helping find solutions. Dementia is a hidden life-limiting condition. You look at me like this and you wouldn't know I have dementia. No one can see what's underneath. Dementia is not just about memory. It affects your cognitive ability and sensory issues. There are fluctuations not only on a daily basis, but even hourly. I can function well 1 minute and then things can quickly change. Rachel asked me what I thought was needed in improving support for people affected by Lewy body dementia. Here are some thoughts. We need to raise awareness about Lewy body dementia and have access to the right information. There needs to be better coordination between services to avoid delays in seeing the right person. The memory service didn't want to see me as I had already had a diagnosis, so I had to wait to see a neurologist for about 3 years. I've been batted between services. There needs to be better follow-up. Someone, a specialist, who knows about your condition. You get all these questions going around in your head and no one to ask, which makes you anxious. What would be helpful to me and others living with Lewy body dementia? A person living with dementia may not remember what they did yesterday, who they were with or where they went, but they will always remember how you made them feel. So smile and be kind. These things cost nothing, but mean an awful lot. I would like to leave you with a poem I wrote, and I'm no poet. I am still me, why can't you see? The same face, the same smile, dementia can't hide. Just see what's in my heart and inside. You will be pleasantly surprised. I am still me.
Thank you. So some really powerful messages there, which I used alongside some of the other feedback that people gave me. So I'm going to hopefully just reflect on the things that Chris said, but also kind of just talk about how that actually fitted with what other people were saying as well. So when I asked some of the stakeholders, so this included families and professionals, these are the kind of things that people were saying, that there was a lack of knowledge amongst professionals, that getting a diagnosis was still difficult, poor coordination between services, not enough support for family carers, and you can see the rest there. I asked the same questions to the Admiral nurses based on the themes, and they really mirrored actually quite a lot of that information. Apologies, I'm skipping through some of the slides. There's a lot of information, but hopefully it just gives you a glimpse into how I kind of learned really about what people were saying was missing. One of the other things I asked was about kind of symptoms and which were the most challenging, and this was really important in helping me kind of think about, well, how do I target the information and support that I offer? And you will see here that the things that kind of appeared as most frequently were things like sleep disturbance and fluctuations. What this chart kind of shows, actually there's some slight differences opinions between what professionals cited and what families said. And you will see, for example, loss of function independence was cited by families but haven't kind of been picked up by professionals. Things like the sleep disturbance, understandably, seen by families, the loss of relationship, which is something that perhaps professionals haven't really kind of thought through. So I also asked about what people felt was how the nurse, this role could have most impact. And so people talked about raising awareness of families' needs, bearing in mind this is a national role. offering some training support for other professionals to increase their understanding, looking at developing specific information for families and offering direct support, amongst some other things. So what have I been up to? Well, I have been linking increasingly with specialists, looking at literature. I've started delivering some training, doing some webinars and talks, including for the Three Nations Dementia Working Group and the Parkinson's UK for their Neurology Academy. I've also been doing some online training for Admiral nurses, and I've got more to do around that. And I started offering some kind of direct clinical support in June 2020, and referrals come to me via our Admiral Nurse Dementia Helpline. Got lots more to do, including developing some specific resources. I'm going to be asking for involvement from people affected by the condition to contribute to make sure that they're right and they're meaningful. Continuing to share good practice. I'm really keen to hear about what other services are out there, and yep, still continuing to raise awareness. So we're going to leave you just with some information and contact details for our Admiral Nurse Dementia Helpline, and people can contact that at any point, either family members, people with dementia, or professionals to find out more information. So thank you for listening. I'm just going to finish off by saying thank you for joining us. I hope it was interesting, and thank you, Chris, for joining us and for sharing your story.
Thank you.
Thank you very much.